I am so delighted to meet you in the program of 1 minute please. So what is the essential difference between injection Ceftriaxone and injection Cefoperazone? Even though both belong to third generation of cephalosporin and there are quite stark differences among them. Ceftriaxone has good amount of off-life, I mean 6 to 8 hours. So Ceftriaxone can be given daily once. On the other hand, Cefoperazone has short half-life 1 to 2 hours, so it should be given twice daily. And Cefoperazone can penetrate meninges. When you consider a patient suffering from acute meningitis, then you should prefer Ceftriaxone over Cefoperazone. And Ceftriaxone can handle good amount of community acquired bacteria. So whoever has community acquired infection, so basically you can prefer Ceftriaxone over Cefoperazone. When it comes to antibacterial spectrum activity, Cefoperazone scores over Ceftriaxone when it comes to Pseudomonas. The most important difference between the Ceftriaxone and Cefoperazone is Cefoperazone can act very well against Pseudomonas. When someone is on injection Ceftriaxone, but when you suspect the Pseudomonas, then probably you may be forced to switch over to injection Cefoperazone. Otherwise, the antibacterial spectrum almost similar. Since Cefoperazone is always combined with sulbactam, sulbactam has intrinsic activity against Acinetobacter baumannii. So when you combine Cefoperazone with sulbactam, then definitely it can act against Acinetobacter baumannii. So the main essential difference between the Ceftriaxone and Cefoperazone is very much active against Pseudomonas and Cefoperazone can act against Acinetobacter baumannii. But the most important difference is it should be guided by your local antibiogram. That's very, very important. By contrast, injection Ceftriaxone acts very well against Salmonella typhi and Neisseria gonorrhea. That's the reason it is very useful in multi-drug resistant enteric fever and as well as gonorrhea. When it comes to metabolism, usually Cefoperazone is almost excreted through the biliary tracts. That's the reason it is very useful in biliary tract infection. On the other hand, only 30 to 40% of Ceftriaxone is excreted in the biliary tract, and there are some studies which reveal that Ceftriaxone can promote biliary sludge. So those who are harboring gallstones, then probably Ceftriaxone may be deferred. And injection Cefoperazone has been implicated in such a way that it can interfere with vitamin K metabolism, so it may interfere with clotting factor synthesis, so it may promote bleeding. So those who are under malnutrition and those who have severe liver disease and those who are on anticoagulant, then probably you should exercise caution when it comes to injection Cefoperazone. Injection Cefoperazone can interfere with alcohol metabolism. So how it is relevant in our day-to-day practice? After the administration of injection Cefoperazone, if someone consumes alcohol, what will happen? So generally when you consume alcohol will be converted into acetaldehyde with the help of alcohol dehydrogenase. This acetaldehyde is a toxic substance. This acetaldehyde will in turn be converted into acetate by acetaldehyde dehydrogenase. This acetate is a non-toxic substance. But since Cefoperazone contains NMMT side chain, this molecules interferes with alcohol metabolism in such a way that it inhibits acetaldehyde dehydrogenase. So there is enormous accumulation of acetaldehyde which is toxic. So that's the reason when someone consumes alcohol, the routine alcohol metabolism is interfered with administration of injection Cefoperazone, resulting in enormous amount of acetaldehyde. This acetaldehyde will cause enormous vasodilatation, so patient may develop severe flushing and tachycardia and sweating and all kind of autonomic instability. So the most important thing is after administration of injection Cefoperazone, alcohol consumption should be deferred at least 3 days after the last dose of injection Cefoperazone. So the most important two contraindications for Cefoperazone is those who are suspected to have vitamin K deficiency and severe liver disease in view of coagulation disorder leading to bleeding, better to avoid injection cefoperazone, and after administration of injection cefoperazone, alcohol should be avoided at least for 3 days. And in fact, during the time of injection cefoperazone administration, if someone consumes alcohol containing cough syrup, even the elixir can produce this kind of flushing and sweating, and you should be very mindful about that. So what are the key messages? So from head to foot, when you suspect acute meningitis, the drug of choice is injection ceftriaxone because of good penetration. When it comes to pneumonia, if it is community acute pneumonia, then probably you can go ahead with injection ceftriaxone. If you suspect pseudomonas, then probably due to hospital acute pneumonia, then switch over to injection cefoperazone. When it comes to enteric fever and gonorrhea, then injection ceftriaxone scores over injection cefoperazone. And when you suspect Acinetobacter baumannii because of presence of sulbactam in the combination, that has good activity against Acinetobacter baumannii. Two important contraindications for injection cefoperazone is when you suspect the situations where vitamin K deficiency is prevalent, then probably cefoperazone should be given very cautiously. And second one, those who consume alcohol, then you should defer injection cefoperazone, or alcohol should be consumed only 72 hours after the last dose of injection cefoperazone. Thank you.